Hello, 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 hello. Hello and welcome to my channel Physiotrendz guys. This is me Physio Prem Shah and I'm very excited for this live session because I've got so many questions from you all and this physio talk session which I have started from this week I'm simply going to answer all your questions whatever your queries are whatever you want to know from me and that's only going to be in this during session. I've planned to keep this session maximum for 40 minutes. So you can join anytime and you can ask your questions over here in the chat box and I'll try to answer those questions. And before that, I will just read out the questions what I have got so far so that you will come to know that what are questions I'm going to answer today. I've got plenty of questions, actually around 20 questions so far from my Instagram and YouTube posts. So first question what I've got is what is the difference between BPT and DPT? Another question is what can I do in India after my BPT with zero experience in order to get good salary? Third question is how can a physio practice in abroad? Fourth question is for masters, what is better option, external or internal if you have zero interest in research? Next question is can we do medical coding after BPT? Next question is all you need to know before entering into sports physiotherapy as a female. Next question is as a physiotherapist using artificial intelligence and machine learning, what is the scope? Next question is how can I earn 1 lakh rupees per month as a physiotherapist in India? Next question is what is the business angle in the physiotherapy field? Next question is ways to generate income after masters in physiotherapy. Next question is can we do job for 1 year and then plan to study masters in physical therapy? Next question is which city is best for physiotherapy jobs? Next question is how much a physio can earn if they have their own clinic in Bangalore? Next question is what are the non-clinical and remote areas where in Indian physios can work in India or abroad? Next question is jobs for freshers in other countries after BPT. Next question is why is that we need to do extra workshops even if we are studying so much in our syllabus? And how to stop quacks, especially quackery, which is going on in the field of physiotherapy. So all these questions I'm going to answer one by one. And thank you so much once again for joining this live session. So let's begin without wasting any time. Let's begin with the first question, which is like, what is the difference between bachelor's in physiotherapy and doctorate in physical therapy? Now, guys, these are two different fields, like two different things. Bachelor's in physiotherapy, we all know that it is a bachelor level course for 4.5 years, in which we are studying all the subjects, basics of physiotherapy. And doctorate in physical therapy is something that we study after bachelor in physiotherapy. In some countries like USA and Australia, they have started making students enter in these fields directly after BPT, and which is a 3 years of course which is somewhat like masters, but you get to do detailed research and thesis work in doctorate in physical therapy. And after that, you'll be having a degree of doctorate. So that is a difference, I would say. And countries like USA, they are planning actually to mandate DPT to work as a physiotherapist, physical therapist in that particular country. So if you have any plans to go USA in near future, and if you are also planning to study over there, rather than studying any master's course, if you're studying directly for the doctorate in physical therapy, it might give you advantage. That's not a sure news, but it's like a kind of talks going on since I would say 3 4 years, but they have not confirmed it yet. So that is it about the bachelor's in physiotherapy and doctorate in physiotherapy. The next question is what can I do in India after my BPT with zero experience in order to get a good salary? Now that's a very interesting question, guys. Now what we have to understand is any field, not only physiotherapy, but any field, if you want to earn good, first you have to skill up yourself. You have to upgrade yourself in the skills as well as you have to upgrade yourself in your confidence, expertise, everything. Okay, so that is why you cannot say that immediately as a fresher you will start earning good money. If you still have, like, if you still wish that, okay fine, it's not that impossible task, but if you still want to do it, you have to start working on your skills since you are in final year or you're in internship as well. So from internship you have started working on side struggle, like you're studying something extra, you're attending certain workshops which are necessary for your skills of whichever area you are interested in. Then when you're out you can show that yes, these are my skills, and on basis of those skills you might start getting a good salary. But I would say that don't expect so much in the as a fresher. First try to give some time in the field, first try to show your skills to the people that this much skillful you are, and then later on you might start getting the recognition as well as good salary. So that's my advice for this. Guys, yes, keep on posting your whatever the other questions are there in the chat box. I will answer to those also. But as I mentioned earlier, I will first answer the questions which I already have received on my Instagram and YouTube post. So I'll just finish off them and then I will come to the questions in the chat box. So stay tuned for that. The next question I've got is, how can a physio practice in abroad? Now this is a very like vague question, I would say, because like abroad also we need to decide which country you want to work in. I'll give you a few examples. Like if you want to work in UAE, so if you want to work in UAE, you just require bachelor's in physiotherapy degree plus 2 years of experience, plus license clearing. Like for example, for Abu Dhabi, you can clear HAAD, which is HAD. Then for Dubai, you have to clear DHA, Dubai Health Authority examination. So likewise, if you're clearing the examination plus you have 2 years of experience after BPT, you can start working in UAE. Same way, I would say if you want to work in UK, you just have to register yourself for HCPC. If you have registered for that, and then you start looking for the jobs. If you are giving interviews, if you get through it, you are getting direct job offer from the UK. You can directly go over there and start working over there. Same way in USA, also if you want to go there, directly I would not say that after BPT actually you can work, but first of all you have to clear NPTE examination, license examination. For that you have to go to USA as a visitor visa, student visa, depends on you how you can go. You have to clear that examination and that you can start looking for the jobs. Canada also you have to clear PCE examination, but one advantage in PCE is that you can also give it from India, from your home also. If the internet services and the other services you are updated with the requirements from the PCE centers. So these are the things that you have to keep in your mind if you want to directly work in abroad after BPT. Various of options are there, and various of ways are there to go over there. Many of the students choose to go as a student visa, and many of them directly choose to go as a PR. Many of them directly choose to go as a work visa. So there are various of things, and if you want to know more about it, I have already uploaded some videos on my YouTube channel already about each and every countries. I have spoken about UAE, UK, USA. All the playlists are there on my channel. That also you can go through, in which you will get detailed information about the same thing. Okay. Next question is, for masters, what is better option, external or internal? If you have zero interest in research work. Now, my dear friends, remember, yes, we know that back of the things like external master programs are going on, but we should never promote this, because if you're promoting these external MPT degrees and everything, this is going to harm our profession only, because people who are doing external MPT, they are not at all studying as a MPT, because the MPT is not only about research, it is also about developing your skills, like in research work, evidence based practice and everything. And that is possible only if you are directly going to the college, you are attending classes, you are giving some journal presentation, case presentation, developing your communication skills. This is all your masters is all about. If you don't have much interest in research, it's okay, you can start developing your interest in research, and then you can work on it. You can take help from the faculties, your seniors, or somebody else from the outside. But don't just worry, just run away from the research. You can still learn it, don't worry, it's not that difficult. It's not like a rocket science that you cannot do it. So don't worry about it at all, you can still do it. So but I would suggest, don't opt for the external option directly. Can we do medical coding after BPT? Definitely you can do it if you think you have good communication skills for it. You have good skills to put some numbers, like like share whatever the reports you have in the codes. If you have those skills, if you're ready to get trained in that, definitely you should go for medical coding. There is nothing wrong in that, and I would say that there are various foreign companies as well which are hiring people after BPT, after BAMS, after MBBS, different courses for these jobs, and they are paying a good amount. So if you are really interested into it, you should go for it. There is nothing wrong in that. Next one is all you need to know before entering into sports physiotherapist as a female. Very good question, I would say, because see, guys, as a female, if you want to go in the field of sports physiotherapist, it's a very good opportunity in the current days, I would say, because there are so many female teams coming up. Like recently we have also seen that female cricket IPL is going to come up, right? So there are teams like RCB who have already bid, and everything is over. Like RCB is there, Mumbai team is there, Delhi team is there. So like women cricket is also encouraging IPLs and other things. Not only cricket, football, other tournaments also they are promoting women sports. So there is a huge scope as a female physiotherapist in this field. What you need to take care of is, like, first you need to decide that which exact sports you want to become a sports physiotherapist. Second thing is, you yourself should be fit. You have to work on your fitness as well, so that you can understand your players fitness, as well as you can work on their fitness for longer duration of time. So it's not like that if you want to work as a sports physio, you will just sit in the clinic. You have to be on the field for regular period of time, and also, so that is why your fitness matters a lot in this. Plus, you have to keep yourself updated, because on-field physiotherapist means that how quickly you can fix problems of the athletes or players. So for that, you have to keep your basics very much clear. You have to keep your skills very updated. That, and also not only skills but also things about like what are the latest equipments are there which can cure patients pain, difficulties, and range of motion restrictions, everything in a very minimal time. So all those things you have to keep yourself updated, and then definitely you can enter the field of sports. And yes, again, don't expect that from the very first day after doing masters in sports you will get a work in a big teams like that. First, you need to start showing your skills to the on the athletic population. Once you gain some confidence, some trust from the athletes, you definitely will get many of the opportunities, as I said, because female sports has been encouraged globally in every sports. So you really have a very good scope in that. Next is as a PT using AI and machine learning. Yes, it's already being done. People are using artificial intelligence, people are using virtual reality, people are using tele-rehabilitation in physiotherapy, and it's going very nice. So if you have skills for it, if you want to learn it, if you want to get yourself updated in, definitely you should go for this. There is no harm in that. So please, if you can learn it, go for it. Find researches and start reading about those stuff. If possible, if you find some laboratories where you can practice this artificial intelligence and virtual reality, you can get exposure to it. It's a very good scope. I'll tell you one story about, like, I came across one physio who is already working on this virtual reality for stroke patients, and he had developed a device which could give you more than 200 exercises just using their virtual reality, and also those data you'll be able to get on your mobile phone. Patient can also see on the mobile phone, as well as therapist can keep a track record of whatever the exercises patient is doing, how much range of motion is increasing, how much repetitions are done, everything you can keep a record on. So AI and machine learning is booming right now. If you are getting your hands on it, definitely that's a very good idea. So keep it up. Next is, how can I earn 1 lakh per month as a physiotherapist? Well, earning 1 lakh per month is not that difficult, I would say. But only thing is, you have to start working on two, three income streams. Like, you cannot just rely on one job or just one home visits. You also have to start thinking about, like, okay, what extra out of the box you can do for the field of physiotherapist. Like, if you have good communication skills, you can go for teaching. If you have good skills in explaining stuff to the patients. You can conduct webinars, you can conduct seminars for the patients, you can meet new people. You can also start your own business in physiotherapist. Like you can also start selling some equipments which are very much basic and important for the practice of physiotherapy. You can also give some ideas to the patients or fellow physiotherapists to work under you, and you can develop your business in that. So my point over here is to earn 1 lakh per month. You cannot rely on one income source. Just like, for example, if you're relying only on the job, not going to help. You have to start thinking of different opportunities, different income sources that you can develop, and that will not come in 1 or 2 years. It will take some time, but definitely you can do it. Next is, what is the business angle in physiotherapy field? Well, just now, as I explained, there are so many angles in business for a physiotherapist. But one thing I would suggest for anyone who is looking for a business opportunity in physiotherapy is start working on the problems in the field. Like, for example, I'll give you one simple problem. Most of the time, what happens with us is patient stops coming to us because they think that they have to pay 500, 600, 700, or 1000 rupees per session for a physiotherapist to do some exercises or to get some modalities. Okay, so most of the patient's psychology is what, that if you're going for one day, you're paying 1000 rupees, 500 rupees, and in return what you are getting is you have to do yourself some exercises, you have to get some machines. Okay, fine, that's not a problem, but then how many days you will keep on doing it? And when that psychology comes in mind, they will start comparing that with the other doctors, like other healthcare professions. They will think that other healthcare professionals, they are charging me 1000 rupees, but they are giving me medicines for 1 week or 10 days, and I don't have to do anything, I just have to take that pill. So I know that that is ridiculous to compare like this, but again, this is patient psychology. You cannot change it. You have to deal with it. You have to find solution to it, like how you can change this psychology, or how you can manipulate this to bring patients more and more, like for more and more sessions, and give them, show them some results, visible results. Definitely you should have skills, but also you have to work with psychology. You have to change patient psychology, and you have to treat patients cause of pain. And if you're doing that very well, then you have very good business opportunity in this field. And this applies to anything. Like, it's not about only treating patients in the clinic, it is also about like going for home visit. It is also about like selling some products to the patient. It is also about selling some products to the therapist, anything. Okay, so this rule applies everywhere in the business, that you have to work according to your clients, your patients psychology. So if you could do that, you will have a very good business angles from the physiotherapy point of view as well. And yeah, one more thing in that is, you can take help from the already established people, because those who are already established in the field, they would help you. They would not help you monetarily directly, but they could guide you if you just ask for the mentorship. So that can be a very good way of learning. Next question is, what are the ways to generate income after masters in physiotherapy? Well, there are various ways. As I was telling, you can start working in academics. You can start working on your skills, and if you're confident enough, you want to teach students separately as a seminar, webinar, you could do that. Then you could also directly open up your clinic or center. You can continue with the home visits. There are so many things you could do. Also, if you want, you can work with some multinational companies. Like, for example, there are companies where they require physiotherapists on a weekly basis or daily basis for their own employees. So there you can get attached and start giving them some daily posture correction habits, or some daily exercises which will help them for the efficient work, or some workouts which will have help them for the hand to eye coordinations, or something like balance coordination, everything. So these are certain things which we can start working on after doing masters in particular field. Like right now, if I talk about, there is a huge demand for masters in OBG, or for the prenatal postnatal treatment, as well as there is a huge demand for cardiophysiotherapy after masters in the rehabilitation centers, ICU, respiratory care, everywhere. So first of all, find your interest, passion, do that masters in that, and after that you have many of the things to do for the income source. Okay, now can we do job for 1 year and then plan to study MPT? Yes, you can. There's no harm in that. But I would say that if you already have plans of doing masters in physiotherapy, then do it continuously. Because what happens is if you are taking 1 year of experience and then doing masters, after that when you go for a job, you will still be a fresher. Your 1 year experience between BPT and MPT will not be counted. As well as you will not have to worry about like your 1 year of experience getting wasted or something like that. So that is my advice for you all. Which city is best for physiotherapy jobs? I would say the city where your home is. That would be the best. You cannot say that one particular city like Bangalore, Mumbai is the best. No, it is not like that. Because if we talk about other cities like I just said, Bangalore, Mumbai, cost of living also goes higher. But what happens if you are staying in your hometown itself? You don't have to worry about staying cost, right? And automatically, this cost of living will become regular or normal as per your earning also. So that is why there is no problem in the city, but the problem is there in the like how you work up or how you skill up and how you attend your patients, how you show your skills to the patient, how you communicate with the patient, and that is all depends. So it doesn't matter which city you are in. What matters is where you are most comfortable, where you can connect with people, and where you have low cost of living. That is the best place. Next is how much a physio can earn if they have their own clinic in Bangalore. That's a tricky question. Doesn't matter you have clinic in Bangalore or Mangalore or Mumbai. What matters is just now I was saying how much skillful you are, how much business skills you have, how much you attract your patient. Those all things matters a lot. Okay, so Bangalore, Mumbai, anywhere you can earn up to 5 lakhs per month also. If you don't have skills, you can earn up to 20,000 also. Completely subjective. What are the non-clinical and remote areas where Indian physios can work in India or abroad? Well, people are doing after BPT, they are also doing masters in hospital administration. People are doing masters in public health. People are doing just some fellowship courses after bachelor's in physiotherapy, especially like in orthotics, prosthetics. They are doing in occupational therapy. They are doing in strength and conditioning. They are doing in kinesiology. Some people are working on their manual therapy skills, and some people are also working in MNCs or insurance companies for like confirming claim passing or not. Some people are working in medical coding jobs, like how I answered for the question which was asked. So all these things are non-clinical, which you can work from India as well as from the abroad. Doesn't matter. Next is jobs for fresher in other countries after BPT. This also I answered, guys, that after BPT, if you want to go abroad, there are various countries they invite you, but with some minimal requirement. Like some countries have a minimum requirement of 1 year experience, 2 years experience. Some have requirement of clearing license exam. Some have requirement of clearing only just registration to that particular country. Like in UK, HCPC registration is there. More details again I will tell you that you will get it from my YouTube channel itself. I have created playlists for UAE, USA, UK, Canada, each and every country, how you can go, how you can work, all the options I have mentioned in those again. Next is why is that we need to do extra workshops even after studying the syllabus for the physiotherapy for 4.5 years? And this question was actually the big one, and I liked the most because that person has clearly defined the situation of physiotherapy in India right now. So the question actually entirely was about like why physiotherapy salary is less. Why do we have to do extra workshops even if we have syllabus in the physiotherapy? Why people are going for cupping, dry needling, which is not included in our syllabus? Why our we don't have a strong council which can suggest us like this should be the minimal pay for the physiotherapist? Now answering all these questions, guys, like first of all, yes, there is a problem that we don't have centralized council. Yes, we know that there is a quackery going on. Like people who are not a physio, they are also working as a physiotherapist, and they are lowering the standard of physiotherapy. And those all problems are there, but that we have to overcome by our own self, by upgrading our own self. When you know that cupping and dry needling is not included in the syllabus, don't just rush into that just for the showing off, like like for the branding or like because it looks good. You should not go for that. First, as I told you, just look at the researches and scenario, like how exactly this cupping dry needling is helping. I think so yesterday or day before yesterday only I posted one reel by somebody on my Instagram story that yes, cupping dry needling is okay, but ultimately you know that you have to work on the muscle imbalance and strengthening of the muscles for better function and for better functional activities. So when you already know that your techniques like muscle energy technique, then manual therapy, stretching, mobilization, all these are most helpful, then why should we go for invasive therapy which is not even included in physiotherapy? Talking about again, like why are we paid less? So yes, there is no council, there is no decided pay scale for us. So that is the reason that people are hiring physios for any amount they are ready to work for. And so that is a mistake of physios actually. So what happens is, like, people, physios who are not much confident on their skills, they are not much confident on their knowledge, they are ready to work for the less amount of salary also. So because of that, what happens that those who have knowledge, they also have to work for the less salary because they don't have any other option. They know that if they are not going to take that job, there are plenty of others who are waiting for the job. So if we are not stopping this, if we are not stopping this problem, like we are not working together, we are not showing unity, then this thing is going to keep on going forever. Okay. And again, about councils, so there are some states who have started developing their own state councils. I know that they are also not working up to the mark, but one more good news is that we have, like, I think so all of you must have heard in Narendra Modi ji's speech also, that we have NCAHP Act. We are now counted under NCAHP, and in that physiotherapy is defined very beautifully. I would say if you just go through and if you just read the definition of physiotherapy what they have given, you will also appreciate that. So if that, actually that is supposed to be on act from 2021, and all of us are still waiting for it to be fully functional. So if it is fully functional, we will start getting all the state councils, and also norms and everything will be pre-decided. Also, syllabus for all the states will be equal, because right now we know that Maharashtra state syllabus is different, Gujarat it is different, Karnataka is different, Delhi it is different. So all these dissimilarities also can be changed, and because of that we can create something better. And also in this question, one best thing was asked that why don't we have license exam in India? Because if we have license exam in India, automatically we can just stop those quackers who are practicing physiotherapy without any licensing. So if we start getting license exam, and that thing also is included in the NCHP Act. So that is why my suggestion that you watch that what is NCHP. That video also I have made on my channel. If you want, I will put that link in the section over here in the description of my this video, so that you can check out that video also. Okay, now let's talk about the questions we have asked on the comment section. I'm so sorry you all had to wait so much. I'll start with the first question. Yeah, Anurag, hi. Good evening. Ritik, hi. Tips for MPT exam. Prayag, I would say that if you want to clear MPT entrance exam, start working on your basics like biomechanics, basics of assessment skills, basics of pathology, basics of electrotherapy. All those things, if you are clear with, once you are clear with anatomy, physiology, everything, biomechanics, then definitely you can relate to the pathological condition and you will be able to answer those questions in the easiest way. So first step, what you can do is you start working on your basics. Make a timetable that for 1 week you are going to study anatomy, 1 week biomechanics, 1 week electrotherapy, exercise therapy, like that. Once you cover up that syllabus, then start working on the MCQs. So multiple choice questions you will get from many books, like Suraj Kumar is there. From those books you will start getting MCQ, practice those MCQs, and after that just develop your skill in how to crack those MCQs. If you want to learn that, like, I have also posted so many MCQs on my channel with a playlist called as Physio Quest. You just go through that, you will understand how to crack MCQs, develop your skills with basic knowledge. You will have a very good score, I would say, in your MPT entrance. When the Physiotherapy Council established, that's what I was talking about, guys. NCAHP Act is on working since 2021. You should go and see that video which is on my channel. I'll put that link in the description. Hello, sir. How are you? I'm very good. Thank you so much for asking, and I hope you are also good. Sir, can you tell us how to write the research article? Buddy, to write research article, first of all, you have to define what is your topic, what is the need of the study for your research, and your mother article from where you have to take up the protocol, outcome measures. You have to take references from other articles, recent articles. Then, with that protocol, you have to conduct the study. Once you are conducting the study, that also you have to decide first whether you want to do it as a randomized control trial, whether you want to do it comparative study, experimental study, case study, cohort study, that you predefine with the help of a guide. After you perform that study for duration of 6 months, 1 year, whatever the duration you pre-decide, after that you have to just simply write what you have done for those 6 months or 1 year. So that is in a nutshell, I would say, like in a brief you can understand if I what I want to say for writing a research. Is there any government job opportunities after BPT or MPT? Yes, there are plenty of government jobs opportunities, I would say. But the problem is that appearing, like physios who are appearing for these exams and post how much we are getting vacancies, how much we have, the ratio is very poor. Like, for example, if there are two posts, there are 1,000 physiotherapists who are going to apply for it. So I would say yes, there are government jobs, but I am not saying that you will get that job because lots of people are there to apply for it. How to improve practical skills? To improve practical skills, you have to perform it. You have to experiment your skills on patients. You have to keep on looking patients. You have to have exposure of patients in the maximum numbers. You cannot say that I will just read from the theory books and I will gain my practical skills. No, that is not possible at all. What you'll have to do is you will have to go and see those patients. You will have to treat those patients. If possible, if required, you just go back to the home, you study about the condition, you find out the recent researches which are going on that condition, implicate that protocol on the patient, document everything, and you find out like after weeks or after 10 days what is the result of those treatment on the patient, and that is the way you can develop your skills. And before that, obviously you have to work on your differential diagnosis also. So don't forget that confirmed diagnosis is like a half treatment. So if you are able to do confirmed diagnosis, that would be the best thing. uh, Next is internship guidance. Internship, very very beautiful time of physiotherapy, Harshita. I would say that in this duration, just keep on working on, just now as I said, evidence based practice. Common conditions, just identify those like OA, back pain, knee pain, then neck pain, all these common conditions, find out. Try to go back and find out researches, or you can find it from the books. What is the pathology? What can be the differential diagnosis for the conditions? And then you can find out the researches and just write down two or three protocols and just give those protocols to the patients, and again document the results of those patients. And with this, you can also publish your research, as well as you will be able to learn those things. So that is the best thing to do in internship. Plus, one more thing what you can do is, if you have any future plans of going abroad, this is the best time to prepare for that. Like if you have to appear for English proficiency test like IELTS, TOEFL, or anything, you can start preparing for the same. Or whatever the documentation work is required, that you can do in this period of time. So take maximum advantage of this time, because this is the duration where you just have to treat patients, nothing much to study, I would say. Study in sense of like you don't have to give any exams. So that is why this is this is like a time which you can utilize for your development of the skills. Excuse me. Yeah. So development of your skills and everything in this 6 months of duration. uh, Next question is, best books for clinical practice. They're better than books, I would say. That go up with your seniors, go to the seniors, go to the faculties who are expertise in those particular techniques, and try to observe them, try to learn from them that how to perform those practical skills on the patients, how to communicate with the patients. And that is the way you can learn better practicals rather than just studying from the books. That is my experience. With my experience, I can say that. And yeah, this is a common question. Can BPT add doctor as prefix? Can I open clinic after BPT? Well, you can use doctor after BPT, but the only thing is you also have to use PT after your name. There is no harm in using doctor. Another thing is, yes, you can open your own clinic. There is no harm in that. But when you're opening a clinic, be wise, plan it accordingly, and then only open. Don't just simply open it. Like you, for opening a clinic, you should do a research like which area you're opening, what will be your timing, what will be your target population. Everything you decide first, and then you start working on that clinic. That is my genuine advice to you. देन कितना परसेंटेज चांस है कि पीटी इंडिया में ग्रो होगा आगे के 4 इयर्स भाई प्रवीण I would say that there is lots of scope in India currently because looking at the India's population and looking at the current situation of the people, current lifestyles of the patients, people, we have a huge scope because physiotherapy is all about movement and people have stopped moving much. So if you just stick to your skills, if you just improve your skill set, there is a huge scope in India. Not only in this 4 years, I would say coming 2 years also, because there is a Fit India movement, there is Khelo India movement. So like sports, fitness, everywhere with physios are required. So there is a huge scope, I would say. And I have seen it like since last 10 years. I am seeing like how this physiotherapy field has grown in India. I'm not just saying because I just want to give you false hopes, but I'm saying with my experience that what was it in 2007 and what is it right now in 2023. 2007 is the year when I joined physiotherapy, and I have seen those days. So with that experience, I'm telling it. BHMS versus BPT, that is completely your choice, Joy. It's like in what field you are more interested, that depends on you. I cannot put any comment. But yeah, you can watch one video on my YouTube channel which is about like salary of physiotherapist and salary of physiotherapist compared to other healthcare professionals. That might give you more interest in that. That link also I'll try to provide in the description if you all need to. Tell us about the best manual therapy instructor. Well, if you're looking for best manual therapy instructors, then I would say those who are in practice on the daily basis are the best manual therapist. If you're looking for internationally certified manual therapists who can give you internationally certified certifications, then there are only two in India who are doing is like with the help of Mulligan technique. So Mulligan educators or Mulligan certified educators are only two in India. One of them is Kiran Satpute, who is in Nagpur, Maharashtra. One of them is Balaji sir, who is there in Tamil Nadu. So if you get chance to learn from that, then definitely you should learn from them because they will be giving you Mulligan certification, which is valid internationally. One of the workshop of Kiran Satpute sir is happening in Gandhinagar, which is near Ahmedabad in 25th and 26th March, which we Physiotrendz are only organizing. So if you are interested, then you can ask in the comment section about it to me. Next is hello Harshada, hello Ruchi. Thank you so much for joining this session. Are there any physiotherapy colleges hiring online lecturers, lecturers being BPT graduate with many years of experience? Well, I would say that any universities right now they are not considering only BPT for lecturers jobs, but and also like online jobs right now. Okay, during COVID time it was helpful, but we know that physiotherapy is a kind of field which requires more of the hands-on skills. So that is why online will not work that much. If you are ready to work somewhere offline, I think you should try locally in your colleges. Sir, is it possible to treat patients in third year or only observe them? I would say still observe them because you are not so skilled right now to treat patients on yourselves. You can treat or you can just do certain techniques under the observation of your senior or some faculty. That's not complete no also, complete yes also. I would say just do it with proper precautions because we don't want to get blamed as a profession later on. Like if something goes wrong with the patient because of your mistake, it is like whole profession gets blamed. So I don't actually advise anybody in third year or final year to directly go and see patients. So there is any difference between doing BPT in private college and government college? No, there is no much difference at all. Yes, there is a difference in fees, I think, But apart from that, there is no much difference, because I would say that government colleges also gives you good exposure. Private colleges, if you are choosing the right one, you will get good exposure as well as good facilities plus faculties. So yeah, it's kind of like 1920, I would say. It's not that much difference. Sir, is there any specific national or state exam for MPT entrance exams? No, there is no common state or common national exam. But yeah, sorry, there is no common national exam, but there is a common state exam, each state wise. Like for Gujarat, state exam is there, for Maharashtra is there, for Karnataka is there, which you can give for the general admissions in the particular state. But for that, you have to be what you say, resident of that particular state, then only you have advantage. Otherwise, if you are from outside, then your rank will be considered as an all India rank. So that's something that you have to work on. Malpractice ruin our profession. I agree to you, Ankur. Can we go abroad after BPT? Yes, definitely. I just said that after BPT you can go to different countries. The only thing is you just have to fulfill their criterias for each and every countries, and for different countries, criterias are different. And those videos you will get from my channel. I'll put the links down in the description. After BPT, is there any part-time jobs available in Australia? If yes, you can suggest. Actually, Australia is a country which will not allow you to directly work after your BPT basis. You will have to clear the license exam first, and then only you can work as a physiotherapist over there. Otherwise, if you are going there as a student, you can work as a physiotherapist assistant. But as a physio, you cannot work directly part-time or full-time. As we've seen recent advances in our physiotherapy field, I think BPT should be 5 years duration course in future, and PG should be 3 years. That really depends. Actually, I cannot comment anything right now. But I would say that like there are certain universities, those who have started semester system right now. There are certain universities they are still going on with the year system. There are certain universities those who have divided biomechanics in two parts, first year and second year. So things are going differently right now. But as I said, if the NCAHP Act is full-fledged working, we might get common syllabus all around India, and which will be a great thing to do. Is it better to open a private clinic or work in hospital? Hmm. That's again completely your choice. If you have better skills, if you have business skills like management skill as well as skills for treating patients, go for opening your clinic, because long term that is going to give you more benefits, that is for sure. And if you want to work on your skills first, you want to experience yourself, you want to experiment yourself on your skills, then first take some job in a hospital, gain some experience like how the hospital runs, how they are managing the patient, get some knowledge about it, what is the target population for them, get some knowledge, and then you can start your own clinic. So these are both the ways you can work on this. uh, Next one. Best college in Ahmedabad for MPT. Best college for Ahmedabad is like you have obviously civil is there. Then I have heard that AIMS JG. Then you can also go to yeah, I can remember of this many colleges in Ahmedabad specific, so you can work on those. Which manual therapy technique is not effective as advertised according to evidence base? Which manual therapy technique is not effective as advertised according to evidence? I didn't get your question actually. See, manual therapy techniques. Basically, we know that there is a concepts given by Maitland's, Mulligan, Kaltenborn. All these techniques have shown their effects in different patients. Also, McKinsey is there. So all these techniques are actually effective. I have not found that they are not so much effective, and evidence also shows the same thing. So I have not seen any techniques which are not showing effect. Why JIPMER is categorized physiotherapist as Group C post, while other national institutes like AIMS physiotherapist Group B post? Uh, for that, I don't know what to say, because it's like their own decisions. In that, we cannot comment anything. But yeah, once the council is set, I think all these problems will be solved for us. What will be beneficial in abroad or after BPT or NPT? My suggestion is, if you have vision of settling down in abroad countries, foreign countries, go after BPT. because after MPT, if you're going, it doesn't make much sense according to me. Do you think telerehabilitation got good scope in coming future? Yes, it has got good scope. I would say that. Nowadays, orthopedic surgeons also knows our TKR, TH are not successful without physiotherapy. I agree, yes, and that's a good thing for us, guys. Like they have realized what is the value of physiotherapy, and they have started giving more opportunities to the physios in coming days. So that's a good thing for us. Highly appreciate your patience to answer all of questions helping the physiotherapy. That's what I am here for, and that's why I have started this Physio Talks series. That I want to know you people, I want to know your questions, and I want to answer them so that you can become a successful physiotherapist and nobody gets demotivated by some people saying that physiotherapy is not a good field. So that is the only my motive of starting this session. And thank you so much for appreciating that. Most people think there is no benefit of MPT because at last he or she gets his 25K job, but my experience says physiotherapy and said, yeah, man, it's not about like, it's always subjective. See, if you're passionate about your field, if you know what you're doing, if you upgrade your skills, sky is the limit. Not only 1 lakh, you can also earn 2 lakhs, 3 lakhs per month. So yeah, and yes, one more myth, like MPT is not only for academics, guys. It is for upgrading your knowledge also. So don't just think that MPT you should do only if you want to go in academics. No, it's not like that at all. People are doing MPT because they have interest in that particular specialization. So think like that also. Best workshop that a BPT pass out students or finally should invest. It's not like there are any best workshops or something like that. The only thing is, buddy, that make sure that whatever workshop you're attending, that those are the authentic ones, and most probably, if possible, hands-on workshops, and they are giving you a better upgradation of the skills. If you are getting that, and yeah, this is enough, pretty much enough for that. Is Atal Bihari Vajpayee University College good or not for MPD? I have no idea where this university is, so I cannot comment on that. Is there a wise decision to work in a multi-specialty hospital? What are the pros and cons? It's a very nice decision if you can work in multi-specialty hospital. Pros are that you will get to see patients in each and every specialty. You will get to get connected with all the kinds of doctors or the specialized doctors. You will be able to reach out to them. You will be able to know from them about different patients, and also you will be able to raise awareness about physiotherapy in each and every profession. So I would say that is the best thing you could do. Cons can be like you will have to work more for the patients. Like you will get to see, you will have to work on patients from cardio section to ortho to neuro, all the sections. So that might be tiring task. But yeah, again, if you are looking at it from the experience based point, I would say that's the best thing you could do. Can you make a video on your physio journey? Sure, I will. I think I have discussed about that many times, but yeah, particular video is not that, but maybe sometime, sure. I seen a small village's BHMS doctor also use TENS and IFT. Now that is stupid. I know that they are not eligible to do that, but still they are doing it, and we have to stop them. If you find out, if you notice them, I think you should go and talk to them that you are not supposed to do this without knowing the what is the main importance of this equipment or how does that work. Like you should ask them what is beat frequency in IFT. If they are not answering that, just take their machine and go back to home. I would say that, because you will get a machine also, and because you know what is beat frequency, you are the right person to use it. Try to give this session every week. Yes, I would definitely try that. I keep this session, and you guys also please keep suggesting me more and more topics and whatever questions you have, so that I can speak about it. Hello, sir. I hope you are doing well. My question is, how much of weight training and self training is important to be a successful? It's very much important, but just now I said that being a sports physio takes a lots of work, and you got to work on yourself first to understand the psychology of athlete, and also to understand the physical requirements of athlete to solve their problems. So it is very, very, very important. It's like the highest priority, I would say, being a sports physio. How scope for pelvic floor is a very good scope, because nowadays people are getting so many problems with pelvic floor related issues, especially women population. I should not say specially, yeah, but yeah, woman, man, both gets this. So it's a very good scope because people are more aware about it right now. Is there any benefit of fellowship courses? Yes, there are benefits because fellowship means you are going to work on that particular segment which you are interested in. So that gives benefit. If you want to know about the fellowship programs, you should visit my Instagram channel where I have posted one reel which is giving you knowledge idea about where and all fellowship programs are going on after BPT as well as after MPT. So that list you will get from that. Onco rehab fellowship also is going on. Onco rehab basically for physiotherapy point of view is mainly about reducing pain for the patient and increasing their movements, increasing their range of motion. So it's like a very good scope in that again, like because onco rehabilitation nowadays is giving so many opportunities to the physiotherapists and they have shown very positive response also with the help of physiotherapy. So that's all about. Thank you, sir. I'm first year BPT student. This session is very helpful for us. Thank you so much for being here, Arshada. Make a rule like license is mandatory for purchase. Yeah, I agree, but yeah, we will try to implicate that rule. Please create a video regarding lower back pain in young people. Okay, I'll make something on that. Sports physio, Australia or Canada? Australia. Assistant professor in private colleges starts somewhere around 25 to 30 depending on which university you're applying. How soon or how realistic do you think the stipend availability of interest? No, 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 no. Now that announcement, guys, yes, I wanted to talk about this. Good you asked this question, by the way. That announcement, if you have read it clearly, it is said that they have suggested to the universities or management that you should start providing incentives or stipend for the intern students. So, guys, they have used the word suggested, they have not mandated it. So, please don't keep false hopes because this is purely decided by your management of the hospitals. If they want to give, they will give. Otherwise, IAP just has suggested it. So, just forget about it. What are the few tips you would give to the first year BPT student? First year BPT students, guys, this is a very nice field, so be encouraged and make sure that you are learning all the basic subjects like anat, physiology, biomechanics very nicely and understand the concepts. Don't mug up anything because anatomy is not something you should mug up, you should understand. Biomechanics, you should understand. If you're understanding these subjects right now, second year, third year, final year will be very much easy. Is there any new physiotherapy registration body in Maharashtra? No, it's just OTPT Council as far as I know. And that's it, guys. So I guess pretty much it. Good questions going on, guys. We'll end up this session here. Actually, I had targeted for 40 minutes, but we have already crossed 50 minutes. So, guys, whatever questions you have now onwards, please write me in the comment section so that those questions will remain there and I will just note it down and that I will continue in the next session. And yeah, thank you so much for being here on this live session. I really enjoyed talking to you all, and I hope you also did enjoy the same thing. And yeah, please keep on sharing your views and keep on suggesting me content like you have suggested me so many things. That also I'm going to note it down and I'm going to deliver that content very soon. So once again, thank you so much for connecting with Physiotrendz and being there, subscribing this channel. Really appreciate you all. And yeah, see you all next time on this live session. And see you all. Thank you so much. Good night. Bye bye. Thank you. Thank you, guys. Thank you. Keep supporting.